Okay. So I hope the screen is visible to you guys.
Yes, visible.
Thank you, Apu. Okay. So today we are just going to go through all the basics of Mrcpch. What is Mrcpch basically? So it is the membership. What is the abbreviation? It is the membership of Royal College of Pediatrics and Child Health in the UK. And why we approach is that now it has become an internationally recognized postgraduate degree on pediatrics, and it is validated in a lot of countries. Apart from, since it is a postgraduate degree in UK, it is of course validated in the UK. Apart from UK, also in the Middle East and some of the South Asian countries. Like as much as I know about my country, Bangladesh, it is also validated in Singapore, and also if it's not completely recognized in some countries, but it does add a lot of value to your CV. Okay, so why should you approach for Mrcpch? Like for me, if I want to approach, for many people it's different. For some people, if they want to move to a different country, for some people it's not suitable, so they want to move to the UK, the practice is better. For some people its salary is more. Apart from the moving and shifting salary, what is the thing? Like for me personally, it's like a complete package, by the time I have done part 1 as well as part 2, I'm not yet done with the clinical, which is the final part. By the time they have designed the Mrcpch in such a way that is most of the all of the Royal College degrees, that you will be forced to study the theory part, the basics part, the clinical part to the deep extent. So if you know one disease, it's not like, okay, you only know the clinical features, they're just asking you tricky clinical questions. It's not that. So by the time you finish part 1 and part 2, you will have a very broad idea. It will really help you to gain a lot of knowledge, and it will help your core residual
हाँ
knowledge.
इनकी आवाज बंद कर दो अपनी आवाज बंद कर दो
I'm sorry, I'm muting you,
म्यूट कर
Dr. Sana.
अरे
Okay, I'm muting you. If you're not speaking, if you have any questions, you can speak. Otherwise, I have to mute you. I'm sorry. Okay. So why do you approach? It's different for everybody. Apart from passing the exam, we should actually focus on like passing, like gaining knowledge. Otherwise, what is the use? At the end of your life, you have a lot of degrees and then you don't have anything in your mind. That's like no use. So basically, from this was my reason. For different people, it's different. Now, what are the advantages? First of all is that it will upgrade your knowledge and you can learn an internationally recognized degree. It's like a good recognition. It acts a good validation to work as a pediatrician in the UK. After completion of Mrcpch, I think I think Dr. Ruby, I have muted you because again the sound. Okay. So after completing Mrcpch, what will happen? If you complete all the parts of Mrcpch, that is part 1, part 2, part 3, then you will be given, after that, when you do OET, you have to do OET, you will be given the GMC registration as well as entry into specialized trainee level. Now the UK, for specialized, for example, for the specialized subjects as well as for like post graduation, you say surgery, for medicine, internal medicine, pediatrics, it is usually 7 to 8 years of training. So if you do Mrcpch, you will enter, you will bypass first year, second year, third year, you will bypass into year number 4, fourth year resident. You will be a fourth year specialized trainee, and as well as you can also join a job as a registrar. This is if you complete all the parts. But if you complete part 1 and part 2, you will work in the ST3 level, which is the third year of specialized training level. Now, apart from this, if you're not moving to the UK, what are the benefits of doing Mrcpch? The benefit is that, especially I can tell you about Middle East because I live in the Middle East. In the Middle East, that is in UAE, after completion of Mrcpch, along with 3 years experience, you can actually work as a consultant. But the condition is that you will have to clear the licenseship exam, which is very easy, to be honest. That's what everybody say. And in your own country, there is a South Asian countries. I do hold classes. I take classes for MRCPCH Part 1, and I have a lot of doctors coming from Pakistan, Bangladesh, from I think Sri Lanka. Then I have a lot of doctors from other places. So everybody is doing that, even though in some countries it's not completely recognized by the authority, but it is hugely valid, and you can work in corporate hospitals. If you guys have any queries related to it, you can always interrupt. There is no problem at all. I'm just going, side by side, because I think many people are very reluctant, or maybe they don't have enough time to open the RCPCH website and go through all the details. The best thing is you can always go through the RCPCH website, but I have just tried to summarize it. You can appear for the exam. Now, for the part 1 exam, there are 3 parts: part 1, 2, and 3. Now for part 1 actually has again subdivisions. Okay, one is FOP, one is TAS, which is FOP means foundation of practice, and TAS means theory and science. That is for part 1. Part 2 is called AKP, applied knowledge in practice, and part 3 is clinical. Now, when can you apply for the exam? You can obviously apply for the exam anytime after your MBBS. You're done with MBBS, you can apply for it. You do not need any internship certificate for applying for the part 1 and part 2. But if you want to apply for part 3, it is recommended to get 2.5 years experience in pediatrics. Within this 2.5 years, 1 year is recommended to get an experience in NICU. Okay, so if you have just passed MBBS, and there are so many of you, I thought of writing the queries. There are so many queries that can I join? I have passed MBBS, I have just completed my internship. Yes, you can definitely do this degree. There is no restrictions. You don't need any experience for part 1 and part 2, but it's recommended. If you want, see, if I was given a chance, I would definitely go for training in pediatrics, and then you simultaneously you can do this study. You can study for MRCPCH. That will definitely help you. But if not, it's not compulsory. I have not trained in pediatrics. I did work in other departments, but not in pediatrics. But I was able to clear the exams without any problem. Okay. Okay. Now, next one is, it has 3 parts, as I was saying. Part 1 is FOP or TAS, and these exams are conducted 3 times in a year: in February, in June, and October. And part 1, even though it contains 2 parts, it's actually completely separate. If you pass, you have to pass them separately. If you fail, it's like you fail separately. It's not like if you fail one, you will be failed in both. It's nothing like that. Either you can take the exam together, or you can take the exam separately according to your convenience. Part 2 is known as AKP, which is applied knowledge in practice.
It already started. I am waiting on that Facebook page. Some Zoom.
Yes, already started. I'm sorry, I had to mute you. Okay. Part 2 AKP exam, it takes place conducted in January, May, and September. So basically, part 1 and part 2 will be conducted 3 times a year. And then when do you register for the exams? For the registration of the exam, that is, registration is different in RCPCH and booking is different. For booking the exam, usually before 2.5 months, they'll open the seats for bookings. And for clinical, it's different. Sometimes due to COVID situation, there has been a lot of changes. So I have kept that blank. For basically, we are focusing now on part 1 and part 2. And I have not completed clinical, so I cannot comment much on it. Now about the fees is different. Okay, I'll talk about this, how we should apply the fee. Now, if you're planning for giving the exam, I have actually met a lot of very well-to-do people who thinks like we can just give the exam for experience. It's very good. There is nothing, wrong with that, but it's a lot of money. And I feel like if it's always a hard-earned money, if you're investing in something, you should put your like 100%. And it's not only about the money. It's like, why am I paying so much money if I'm not gaining any knowledge? So before, the fee is different for different country. It is usually paid in pounds. So I'm not mentioning. I do have a video on YouTube that explains the fee, and I'll try to post the fees separately on my WhatsApp group and Facebook group. But then the fee is different for different country, usually around 400 to 500 pounds. That's the fee. But if you're doing part one FOP task together, then the fee will be slightly less. Somebody is speaking, please mute yourself if you're not talking. Okay. How should you apply? So if you have planned for the exam, first what you should do is that just plan. You are not even thinking of writing the exam in any near future, but still it's free. So you can always go to the RCPCH website. It says RCPCH, that is Royal College of Pediatrics Child Health, and make an account for free. And after making an account, you can register for the exam. For the registration, you will need your certificate, that is MBBS certificate. And sometimes in some people, some medical colleges are not recognized, or due to any minor reason, sometimes they do ask for other details, like there are a lot of registration number from your medical and all that. After that, you can wait, you can prepare for the exam, and then when the seats booking open, whenever you think it's convenient for you, whenever you're prepared, then you should go for booking the seats. Registration for exam is different from booking. Registration is like only registration. Once you register for the exam, you don't have to do it multiple times for the part 1 or 2. It's not separate. It's only one time. You do the registration, it's free of cost by giving your certificate and other information, and you're done. And then you will prepare yourself for the exam, and whenever you feel it's convenient, you can always give the exam. So where do you find the study materials? Usually the study materials you can find now all over the internet. I do have a Telegram channel where I provide all the materials. By all materials, I mean all the books, the recalls, past test, then also some of my handwritten notes. And for my classes, this is only for my classes, like the classes I run for part 1. In my classes, I do provide a system-wise PDF, but I don't provide this for everybody. But otherwise, the general materials are free. And honestly, I think I did this last year. That time I don't remember if I have opened a YouTube channel. In the beginning of last year, I decided to share all the materials, because I remember when I decided to start for Mrcpch, I didn't have one person to give me the materials. Even for the materials, I had to pay, like, just to get the PDFs. It's their system. I don't mind that, but it's like I felt really bad. I felt like, okay, if somebody needs materials, at least you have such a long list of materials. Nobody should. It's nothing. You can just always give it, and people are very generous around the internet. You get all the materials anywhere. Now, for just a minute, what are the materials that you will need? So the study materials for FOP, that is, we are talking about the Mrcpch part 1 exam, which has 2 parts. One is FOP, foundation of practice. One is task. For FOP, what are the materials you need? You need illustrated textbook of pediatrics, clinical cases of FOP. These are the books. Guidelines, we have 2 updated guidelines, neonatal and pediatric guidelines. Please don't call them red book, green book, yellow book. There's nothing like that. They change the cover page of the books every year. So you can address them as neonatal guidelines or pediatric guidelines. Next is you need recalls. Now, what are recalls? Recalls are like the best things in the preparation. You cannot prepare without the recalls. I do not know if somebody has passed without doing the recalls. Maybe before, say 7 to 8 years, when recalls were not available, maybe they might have passed. I don't know. But now recalls have been so important, because 60% of the questions will come from recalls. Okay, I think somebody has... Okay, 60% of the question will come from recalls, but the difference is that they're going to change the framing of the questions. So it's not like you just by heart the recalls and it's going to, come the same way. They will provide a lot of similarity. 60% of the question, I think when you open the exam paper, it's going to be very similar. If you're not speaking, if you're not speaking, please mute yourself. Okay. So recalls are that important, and recalls are basically made by very generous group of doctors who, after coming from exam, they list down all the questions and all the options of the exam, and then it is given to everybody. And after the results as well, they correct the question and answers. There has to be a lot of meetings, and then it is corrected. So when you're studying recalls, it's very, very important.
Excuse me, Dr. Fatma.
Yes.
I want to ask one thing. You have said illustrated textbook of pediatrics is necessary for FOP.
Yes.
So if we have SOP, if we have Science of Pediatrics book,
Mm-hmm.
and I have actually already read that book once.
Mm-hmm.
So that book is used for FOP and TAS. Can we use that book for both of the papers, FOP and TAS?
No.
Or should I read?
See, I wouldn't suggest you if you're going for FOP. FOP is more of clinical. Now we are going to discuss in like the further slides that what is the difference between TAS and FOP. How does the question come? What is the pattern? So since you have read SOP once, I think that should be enough. No need to read it again. But SOP is a very vast book, and it is mainly focused on all the pathophysiology. It is not mainly focused on the clinical. And clinical for FOP is basically foundation of practice, and it is more focused on the clinical part. So for FOP, I would suggest you go for illustrated textbook of pediatrics, definitely. And some people even study illustrated textbook for the AKP as well. It's a very good book. It's not very huge, and it's very precise. And a lot of questions in the exam, I have seen some of the pictures in the exam. They do, take from the illustrated textbook of pediatrics.
Thank you so much.
Next, we have sample papers. Sample papers, there is a huge, PDF of sample papers available online, even in my Telegram channel. Otherwise, you can always go for, if you're looking for the latest sample paper, then you can go to the Mrcpch website and type sample paper for TAS and FOP. You will always get them along with the answers. I'm muting you. I'm very sorry because of the sound. I have to mute you. Okay. And then we have past test. Past test is absolutely optional. If you ask me, I will tell you don't study past test. Please don't waste your time like buying past test subscription and everything. You may study it to know about the pattern, but if you are given choice, that is the reason I have written it in the last. I have not done past test for my TAS exam. I have done only few chapters for my FOP exam. I have not done anything for my TAS exam. I did ask my seniors, and I was very worried that if I should be, what I should do, if I should go for past test. But the seniors suggested me that past test is not needed. And I blindly followed that. Even for my second part, I did not touch past test. You do not need to. If you have a very good knowledge on the basics, if you are studying the recalls, if you're studying the books, past test is just a waste of time. If you want for practice, there are a lot of past test available online, like 2018, 19, 2020, 2020 versions. You can always practice them. But right now, I would say, plus make sure you are studying all of this. You are studying the recalls, sample papers, and go for past test. Because past test is like an online portal. You will hardly find similar question pattern in the exam. By doing past tests, you will get an idea, okay, what's the question pattern or what are the common important topics that come frequently. But you can get the same from recalls, and recalls are more reliable than past tests. So I personally don't think it's useful. Next one is, what are the materials important for TAS? TAS, what is important? TAS is a lot different than FOP. TAS for TAS will study science of pediatrics. A lot of people don't study science of pediatrics. Again, I'm only sharing my experience. So I did study science of pediatrics, clinical cases of TAS and recalls. That's it. It's very precise. Now, what is the difference between FOP and TAS? Okay. What is how we are going to study? So let me show you this example. What will be the pattern of questions in FOP and TAS? Why we are asked to do it separately? Okay. Why we are looking for separate books and everything? Please avoid marking in my board. Just give me a minute. Okay. So for FOP is basically foundation. I hope the white board is available, like it is visible to everybody. Hello, is the whiteboard visible to everybody?
Yes.
Thank you. Okay, so for FOP is basically foundation of practice. Please excuse my handwriting. What is foundation of practice? Mainly, it is based on all the clinical findings and all the clinical questions you will find here. Okay, and task is theory and science. By theory and science, it means it is based on theory and basics. That is pathophysiology, physiology. Then we have some part of anatomy, some part of embryology, all the basic subjects. Now, let me give you an example. For example, I was just explaining this to somebody recently. For example, we have Down syndrome. I have to mute some of you. It's a lot of sound. Please mute yourself if you're not speaking, because I'm recording this. So those who couldn't join, they'll be, we'll try to avoid the disturbances. So how you should study? That why we are referring to different books for TAS and FOP, why we are not just doing SOP, why we are not doing only one book. The thing is, it's how you should study. The pattern of question is very different in TAS and FOP. For example, if you're going for Down syndrome, I will tell you what type of questions from Down syndrome will come in FOP exam and what type of questions come in the TAS exam. Just a minute, please. Okay. So for FOP, as I said, it is clinical based. Mostly will be asked clinical questions. So how do they ask? They will tell you, we have a child who is just been born and he is very hypotonic. He has a depressed nasal bridge, brachydactyly, epicanthic fold. Then he has macroglossia, large mouth. He has a single palmar crease. Okay, these are the features of Down syndrome, and they will tell you this child has come to you with features of heart failure and a murmur, say in the left lower sternal edge. So by looking at by seeing the features, by just understanding what they have written the features, they will not directly tell you this is Down syndrome. Mostly they don't say very specifically. From the given points, clinical features itself, you have to understand. So this is a case of Down syndrome presenting with a heart failure. Plus, along with that, there is a murmur in the lower left sternal edge. That means they are asking you in Down syndrome, there is some congenital heart defect. What is the commonest congenital heart defect? The commonest congenital heart defect is AVSD and VSD. And if a child is presenting with heart failure, this is a case of ventricular septal defect. So they will ask you the questions in this way. So they are going to give you certain features and they're going to ask you, okay, fine, what is the diagnosis and what the child is having, all these questions. This is a part of FOP, which is completely clinical question. They'll ask you everything related to the clinical features. Now, what kind of questions they're going to ask you for the TAS exam? Same from the same topic, Down syndrome. Now, what is the cause of Down syndrome? Can anybody tell me?
Maternal
Trisomy
trisomy
21 dislocation.
21.
Dislocation not disymptom.
Trisomy 21. What do we mean by trisomy 21? That means we have about,
An extra chromosome.
yes, we have 22 autosomes in our body and one pair of sex chromosomes. 22 autosomes means here 22 pair of autosomes. Oh, somebody, I have to mute you. Okay. So in the autosomes, in the chromosome number 21 out of 22, in the chromosome number 21, we have always in pairs, like one from mother, one from father. But in chromosome number 21, we'll have one extra chromosome. This is known as trisomy 21. That is why it's called trisomy 21. Now, what they ask in exam, okay, Dr. Adil raised hand. Please tell me.
Yes, please. I have a question. If you hope you don't mind.
Yes, tell
Right
me.
now we are discussing about FOP, but the people who are thinking that they just appear in FOP and then they move for the clinical exam for a diploma. So can you just give some hint over here also about that?
I have not done diploma in child health, so I do not have idea about it. But my point of view is that if you are completing Mrcpch, why would you need a diploma in child health? Is it
No,
valid in your country? Is it valid in the UK? That point you should keep in mind, right?
okay.
Because if you're thinking about clinical exam, FOP is like, only say, if I'm considering 100% of clinical, FOP is like hardly 10 to 15% of clinical knowledge. AKP is very vast. You will get about 50% of clinical knowledge. The rest you have to get through your clinical experience. So if this is my personal choice, I would never go for a diploma in child health, because if I can get a better degree, which is giving me validity, which is giving me the GEMS registration, why should I go for a diploma in child health? Because as much as I know, like my focus is on the Middle East, so it's not validated in the Middle East as well. And I have asked some friends in the UK, so they had all the mixed reactions. So I was not very sure about it. And I personally haven't done, so I cannot say much about it. But FOP is hardly,
All right.
only 10 to 15% of clinical. If you are doing FOP, but you should study, like if you have a lot of clinical experience, then you can go for, DCH. Because ultimately what I feel is, what is the aim of gaining a lot of degrees? Yes, it will increase your salary, it will give you a status and validation and all that. But then if you're not gaining a knowledge, it's not very useful. That's what I feel.
All right. I have a point that first of all, let's get a diploma and then we can move for carry on this master's program later on.
Yeah, it's different for everybody. It's like totally different for everybody. I always tell my friends that if we finish everything now, what are we going to do when we are old? We'll feel very depressed. So I don't like the concept of running behind degrees. Like for me, it's like that. It could be very different for you. It could be different for different people.
All right. Thank you very much.
Okay. Now for tasks, what kind of question? What will be the pattern of question from the same topic? That is Down syndrome. Now we know what happens is that what is the cause of, we know the Down syndrome is caused due to an abnormal extra chromosome in the chromosome number 21. We are supposed to have 2 chromosomes. Instead of that, we have one more extra, so 3 chromosomes. That is known as trisomy 21. Now there are different causes of trisomy 21, in the molecular level. That means in the chromosomal level, if we zoom, why there is an extra chromosome? This is the pattern of question they are going to ask. So the most common cause of this trisomy 21, who can tell me?
Down syndrome.
Non-disjunction.
Yes, maternal meiotic non-disjunction. So what is maternal meiotic non-disjunction? Due to failure of segregation of the chromosomes in the meiosis 1 and meiosis 2. Usually in the meiosis 1, there will be failure of division. The chromosome will be lagging behind. It will not segregate. So as a result, one chromosome is lagging behind. It is not segregating. It will be constant. This is one of the reasons of this is called maternal non-disjunction. And it is irrespective of the age of the parents, age of the mother. Usually it is prominent after the age of 30, but it is the commonest. Even in the age, if the mother's age is say 21, even 18, this is the commonest cause of Down syndrome. So how they will ask in exam is that a mother has come to you, mother is say 21-year-old, father is 52-year-old, and the child is having Down syndrome. What is the cause of Down syndrome? Now, first of all, they are trying to trick you. This is actually a task question by increasing the age of the father. Now, father's age has nothing to do with Down syndrome. And even if the mother's age is, say, any age, if the mother's age is 35, 25, 21, the commonest cause of this Down syndrome, the baby of having a Down syndrome, is due to maternal non-disjunction. Due to this cause, they'll have trisomy 21. So basically, there are 3 causes of trisomy 21. One is maternal non-disjunction, Robertsonian dislocation between the chromosomes. Another one is mosaicism. So what they ask for the task exam, they will ask you the basic pathology. They will ask you what is the cause of the trisomy 21? What is the cause of Down syndrome? So they'll give you an option, what are the commonest cause? Maternal non-disjunction, Robertsonian dislocation, or it is caused due to mosaicism. Okay. Another question that is frequently asked in the task exam from Down syndrome is that they will tell you this a couple has come to you. They already have a child with Down syndrome. What is the chances of having a second baby with Down syndrome? Okay. So they have given you the age of the couple, that is the father is 50-year-old, the mother is 30-year-old. Okay, if the mother is more than 30, there are high chances of having Down syndrome. Now, what happens is that if Down syndrome is caused due to, as I said, there are three reasons. One is due to maternal non-disjunction. Second one is due to Robertsonian dislocation, and about 1 to 2% is due to mosaicism. Now, if Down syndrome is caused due to maternal non-disjunction, then the chances of having a second baby with Down syndrome is very less. But if the Down syndrome of the present baby is caused due to Robertsonian dislocation, in that case, there will be very high chances of the second baby to have Down syndrome. So these are the questions in a very, root level, in the core level, pathological level that they ask in TAS exam. And for FOP, it's all very much clinical questions. You can easily correlate. I have to meet you, Dr. Fatima here. Okay. So this is about the difference. You take any topic, you mention any topic. For example, just give me a topic. Diabetes mellitus. Okay. So in FOP, what type of questions will come in diabetes mellitus? Since it is pediatric medicine, so type 1 diabetes mellitus is more common in pediatric medicine. Okay, so we'll be discussing about that. In FOP, they will ask you, the child has come to you with polyuria, polydipsia, and RBS is very high, and the child has come to you with weight loss. So in type 1 diabetes mellitus, usually patient will come with weight loss, or patient directly comes with history of diabetes ketoacidosis. And type 2, usually patient will come with a weight gain. Now what happens, these will be the pattern of question in type 1, and sometimes they may ask you about the types of insulin, what is the treatment you're going to give. All these are FOP based questions. Now, what is the question in TAS? What they're going to ask you about TAS, diabetes? So they're going to ask you all the basic pathology, anatomy, physiology based question. Most important thing that they have been asking in the recent years is that they love the pathophysiology. So they'll be asking you, what is the cause of type 1 diabetes mellitus? The cause of type 1 diabetes mellitus is due to presence of an antibody. This antibody, it is an autoimmune disease. So this antibody is produced against the beta cell of the pancreas. So when an antibody is produced against the beta cell, it will completely destroy the beta cell. And therefore, these patients with type 1, what is the treatment we can give? If they're destroying the beta cell, that means there is no insulin at all. So what is the treatment we should be giving? Insulin. We have to give insulin. Why can't we give here anti-diabetic drug, sulfonylureas, metformin? Why are we not giving here? Because in type 1 diabetes mellitus, there is no beta cell. What is the function of sulfonylurea? Sulfonylurea are secretagogues. That means they will increase the secretion of insulin from the beta cell. That will only work if you have a beta cell. In type 1 diabetes mellitus, there is no beta cell. It's completely destroyed. Therefore, since it is completely destroyed, there is no beta cell, there is no source of insulin. So we have to give insulin from outside source. So the question they ask in type 1 diabetes mellitus for the TAS exam is that, what is the pathophysiology of type 1 diabetes mellitus? If a patient has come to you with high RBS along with polyuria, polydipsia, how are you going to differentiate between type 1 and type 2? So if you do the antibody test, that is antibody, GAD antibody, it's called GAD antibody. If you check the antibody is going to be present in type 1 diabetes mellitus. Whereas in a patient with type 2 diabetes mellitus, there will be no antibody. Now they can also ask you, what is the pathology in type 2 diabetes mellitus? What is the problem, basic pathology in type 2 diabetes mellitus? In type 2 diabetes mellitus, either there is some problem, there is some defect in the insulin, there is either the body is not synthesizing enough amount of insulin, or it is synthesizing insulin but the body cells have become resistant to insulin. That means the body actually have some insulin. Okay, Dr. Adil, again you have questions, please can tell me.
Yes, please. It's thanks a lot. It's very good. You have explained. Just I want to know that how can we make a decision that we can go for one exam at a time or both the exam we can give together. So what
For
will be the
FOP
better?
task, yes. So
Yes.
it's like, for if you're going for both the exams, I would suggest to take 5 months at least, because you need a lot of revision. And for the task exam, they have been changing the question patterns nowadays. FOP is well and good if you study for 2 months to 3 months, it's enough. But for task exam, the questions are very, it's very different. Every time, every session, they'll be introducing some new topics and everything. So if you're going for both exams, I would tell you take about 5 months. If you're going for one exam, 3 months should be more than enough. Again, it also depends on how much time you can give every day. If you're doing a job, then what is your speed? Everything you have to keep in mind. But 5 to 6 months is more than enough for two. I personally took some time in
All right.
studying for the part one. Even for part two, some people, actually, I have seen some people preparing in 2.5 months. They're very genius, mashallah, it's very good. But I personally cannot prepare in 2.5 months, 3 months, because I feel like if I'm not studying from the core and I pass the exam, what am I taking home? I'm not just taking a degree. I should be having some, it's not the end of the world. I need to do more. So if you're studying for something, I feel like apart from the degree point of view, you should always focus on the knowledge, because there's something nobody can take away from you. Maybe the degree will not be validated in some country, but your knowledge is always validated. That they cannot change. So this is about type 1 and type 2. And this is the difference. This is how they're going to ask the question. That's why we need different books. So if you look into illustrated textbook, you will see all the clinical features, what is the investigation, all these are usually asked. But if you look into the science of pediatrics, what they ask is about, they will tell you the pathophysiology. So that is why it is important to study different books, because the pattern of question is different. Even if you have a look at the recalls, if you're really busy and if you're not, you cannot go through the science of pediatrics, which is recommended. Science of pediatrics is recommended by the Rcpch themselves. So if you want to know about the pattern of question, and if you think like which exam I should go first, you just look at the recalls. Then you should have an idea that, okay, maybe this is easy, maybe that is easy. For beginners, I would suggest go for FOP first, because FOP is clinical and it's very easy to grasp. You will easily remember, even if you don't have any experience in pediatrics. Trust me, I have done it. So FOP is easy to grasp. And once you grasp FOP, then task exam will be easier. You can correlate things. Like for FOP, what you will be studying, you'll be studying like, okay, clinical features of Down syndrome. For the task exam, you'll be studying again, what is the cause of Down syndrome. So you can correlate. Okay, so these are the books needed, materials needed for task exam, and how much time is needed. This is like frequently asked question, like everywhere in WhatsApp, in my messenger, everywhere. And I was very shocked to see that some people are saying that 2-3 months is required. And I really want to ask them that, how did you do it? Honestly, I will do it. I have done my task preparation alone for like more than about for 2 months. I was completely done. I finished revision long before the exam. But if you're going for both the exam, 2-3 months is never enough. You have to give about 4 to 5 months for both FOP tasks, and that too if you have proper guidance. Okay, because I've seen a lot of people, they're really brilliant people. I have met
Good
some people
evening. I
like
need to
that,
start in my room.
really brilliant, but they don't have proper guidance. They don't know which books to follow. They have not read the recalls. They are just reading past test. I personally know some people who have read past test only, and they completely failed in the exam because they had no idea about the recalls on how we should follow and all that. So If you're going for both exam, take at least 5 months, revise thoroughly. It's a lot of investment. It's not only investment of your money, it's a lot of investment of your energy. And you know, it's a different health system. Sometimes maybe it will take time, but you will catch up eventually. Next one is how you should study. Now this PDF was prepared for my classes, like for my batch, current batch I'm running. So what you should do is that, please forget about this. How you should study is that if you are going to study for FOP or TAS, this I have told in my videos also, choose a system. Whatever is easy, whatever gives you boost, whatever is your favorite. For example, if your favorite system is neuro, you go and choose neurology from either FOP, illustrated textbook, or from SOP. Ideally, I would suggest illustrated textbook because it is very concise and all that. You'll have fun initially to catch up. So study neuro, and I think yesterday itself, I just gave a list of all the major systems and everything that needs to be done for FOP. For example, you are studying neuro. Neuro, you should start with the illustrated textbook of pediatrics. Study neurology from there. Along with neuro, we have neurodevelopment. Study neurodevelopment from the illustrated textbook. This is your preparation for FOP. I'm talking about FOP. So choose a system, study it from the illustrated textbook, and then see if you cannot study line by line, at least just go through once. You'll have an idea. But only going through will not be in your mind for a very long time. Okay. So remember, when you're going through, just highlight the important points. So go through illustrated textbook, then the clinical cases for neuro. There is a huge chart available on the internet. It's available in my channel as well, that according to the system, they have separated the clinical cases. For neuro, they will tell you the which question, which clinical case from neuro is written in the clinical cases book. So open the clinical cases book, do the cases of neuro only. After that, start the recalls of neuro. Since you are doing FOP here, we are going to study about FOP. So you will be studying the recalls of FOP. This is how you'll study for tasks. And while doing illustrated clinical cases, this is your basic preparation. In FOP, we'll have so many guidelines. So not all guidelines are necessary, and not all parts of a guideline is necessary. Okay. So what are the necessary guidelines? Those, as you start reading as well as the recalls, you'll understand those you should complete from the simultaneously from the pediatric and from the neonatal guidelines. Usually from neonatal guidelines, you will hardly have to do much. I studied only few topics from the neonatal guidelines. Pediatric guidelines, a lot of topics are asked from there. So this is about FOP. Okay. Now, if you're preparing for tasks, if you're preparing for the task, same way, choose any system. Again, neuro, you will study from SOP. Now, if you have already started illustrated textbook, if you have already done FOP or you are studying FOP, then studying tasks will be a bit easier for you. So when you go through SOP, you will get so many extra points. It will not be completely new information. There will be some overlapping of information, but SOP is a very, very good book. After that, after studying SOP, if you can read the SOP, it's really good. After that, you should go for the clinical cases of neuro, clinical cases tasks, and only study the recall, study the neuro cases, and then you do the recalls. For the task exam, there is no headache about the guidelines. Mostly guidelines are not required for the task exams. Hardly one or two guidelines, like the very important ones like DKA. Then what all we have exacerbation of asthma. All these are only hardly asked. So for tasks, it's very short, but then the portions are a bit difficult. For people who have done FCPS, especially I know about Bangladesh, for them task is going to be very easy, because FCPS portion includes a lot of basic physiology, anatomy, pathology, so it will be very easier for them. I have known personally a lot of people who have given FCPS and then task was really easy, whereas for some people task was very tough. Like for me, I found task very interesting, but if you compare with FOP, it's tough. Now, about the clinical cases, one thing I wanted to say, clinical cases is like, I have some videos that I have shared with the clinical cases. I think after the class, we'll try to do one just to show you. So many people, even the doctors in my batch, they'll become really sad thinking that, oh, I cannot solve the clinical cases. So let me show you. Are you guys all aware of the clinical cases book? Or do you want me to show you?
No.
Okay,
Please show us.
yes, sir. Let me show you then. Just give me a moment. It was actually supposed to be a very basic introductory class, but okay. Give me a minute. Let me open my books. If somebody have a question, please share the link of Telegram group. Okay, sure. I do. You can look into my YouTube channel for Telegram group, or I'll share it on my Facebook page. Okay. So this is the book. This is called Clinical Cases for Mrcpch Foundation of Practice. That means this is the book for FOP. Okay, FOP, Foundation of Practice. Now, if I'm looking for, say, GIT cases, now there is a chart that I'll be posting soon. I think I'll post today after the class in my Facebook group on my Facebook page, that let's do the cases of GIT. So when you have the cases of GIT, there are total 50 cases here. Let me show you. See, there are total 50 cases and each of this case have some names. Now, how to find which is GIT case? Because some people I know, they just read everything from the beginning. If you read everything from the beginning, if it's not systematically arranged, it will be tough for you. You have just started studying neuro or GIT from illustrated. Now, if you go and start studying respiratory, you can't correlate it. You can't correlate. So how to know? That is, you'll follow certain charts. Let me show you the chart. Okay, I'm very sorry. My laptop is very slow. Okay, can you guys see the chart? Hello, can you guys see the chart? The yellow and blue
Yes.
chart. Okay.
Yes, we can see.
Yeah.
Achha, I have a question, please.
Yes.
I just want to know that in your YouTube video, you have mentioned that for the FOP exam, you have to do, like, we have to do SOP charts also. After completing illustrated book,
Yeah,
SOP
some
charts
charts
and flow charts.
Yes, definitely. Charts are very important because first one is the questions. The questions will give an idea. There are a lot of clinical questions in the SOP books, and there are some important charts. So it's better if you do the charts. I personally, I did them. I did the charts, and it was very beneficial. Because some people, even for task exam, they don't prefer to study the entire SOP, only the charts. The charts are very important. Okay. So
So
here,
for FOP, it's better to study the charts also
yes,
from SOP.
yes, definitely.
All
System
right,
wise,
thank you.
for example, if you're going for, say, I'm just showing a random topic, say meningitis. So in meningitis, there is a very good chart in the SOP book that what will be the CSF finding in meningitis. That is, what will be the findings in bacterial, viral, in tubercular, etc. So how they change the question is that they will tell you a patient has come to you with all the features of meningitis. What are the features? If a baby newborn has come to you or an infant has come, we'll see that poor feeding is there. Then there is a large full frontal. The child will have fever. The child can have rashes, like that, all the features. Now they will give you the CSF findings. That is, the glucose is very low, 0.1 gram. So if they say the glucose is very, very low, 0.1 gram, it is an important finding of tubercular meningitis. So where do you get this information? In the illustrated textbook, they don't have this chart. And this chart is very basic. Whether you're studying for FOP, TAS or AKP, this is the best chart. So SOP, you will get that chart. There are so many boxes and so many pictures. For example, there are certain topics about gonadotropin dependent and gonadotropin independent precocious puberty. I'll show you after the class. So there are many topics which you look into the charts, you look into the pictures. It's very, very good. It will give you really, otherwise, even honestly, this topic, particular topic, gonadotropin dependent, independent, before I opened SOP, I only used to memorize this topic. But once I read the, I didn't have to read everything. I just read the flow chart. There was the big flow chart with pictures. It became all clear that how a patient with gonadotropin dependent and gonadotropin independent precocious puberty is going to present to you. You can easily differentiate it. That is why SOP is very good. And trust me, SOP, you will never feel like you're at loss once you have read SOP. I read SOP so well, and I was very grateful, even though my marks were not that high for tasks, but I was very happy because I know it will help me in the future, like that. Okay, so see, we are going to say choose any system, GIT. So what are the cases of GIT from clinical cases? FOP book 15, 18, 37, 46. What are the clinical cases that are related to GIT and hepato from the clinical cases task book? 17, 18, 19, 20, 25. Let's take any case. For example, I'll just take a random case. Let me show you. This case, GIT cases. These are the cases. (46) was a GIT case. So let's do 46, 209. This is 44, we'll go to 46. This is 45. Okay. Now, see here how the clinical cases are, is the screen visible to you guys? Can you see the case number 46, Melena Monday?
Yes, doctor.
Okay. So what is happening is that, what you can do? How the pattern of question, what are you going to study? So there are so many questions. See, they will give you certain cases, they will give you certain options, and you have to match the option with the case. That means in the first page, you will have some question. This is like an MCQ or an EMQ. What is EMQ? EMQ means extended matching questions. That is, they'll give you 3 scenarios plus many options. You have to match the scenario with the options. So this is the question pattern they're going to give you. And then they give a huge explanation in the next 2 to 3 page. Right? Now, so many doctors, they were very depressed. They say, oh, I cannot solve the clinical cases. I feel very sad. So for your kind information, please don't be disheartened. They have given the explanation for a reason. They do not want you to simply solve this question and it's done. It's not like that. This huge information is given, and these are such good information. Once you read it and once you know how to read it, you will love this book. So there is a lot of explanation for it. If you're not able to answer at once, honestly, I was never able to answer even one question when I first started studying. And when you read the explanation, then you come back to the question again, then you judge yourself. After your first reading, you judge yourself. Please don't study only once and feel really bad about yourself. Oh, my speed is less, this, that. This is totally fine. Okay. So I'll show you how to solve the cases. For example, if we have this case, so what they're saying, you are the gastroenterologist, ST2 doctor working in the local children's hospital. The emergency department refer the following children to you on Monday morning. So we are going to study a GIT case from FOP, that is Foundation of Practice. So they are mainly, all of them are mainly clinical questions. So we have some list of investigation, abdominal ultrasound, X-ray, CT scan. According to the scenario, we have to decide which investigation we are going to do. So the first one question is that this is called an EMQ. EMQ means extended matching questions. They'll be giving you some options and you have to match it. In our FOP and task exam, you will have about 5 to 6 EMQs and the rest of them will be the best of 5, like only the MCQ based question. You have to choose best of 5. So first one is a 16-month-old girl presents with a history of melena for the last few days. What is melena? Hello? What is melena basically?
GI bleeding.
Yes, basically it is a blackish color stool that is resulting due to the GIT bleeding. I have to mute you. I'm sorry, somebody. Okay. So melena. So that means the girl is passing some black colored stool. Her mother says she seemed to have had a tummy pain in the morning, but is better when she has eaten. She fractured her leg 2 weeks ago and when she fell down the stairs, and her leg remains in a plaster cast. She is otherwise usually well. Mother has been giving her medicine to help with the pain. Now, they are saying you this scenario. Now, there are certain things. First of all, before solving a question, you should have some differential diagnosis in your mind. You cannot directly go to the investigation. So this girl is presenting to you with melena. That means she has some GIT bleeding, right? Melena is caused due to GIT bleeding. Now, what is the cause of the GIT bleeding? Usually, the lower GIT bleeding will present as melena, that is blackish color stool, and upper GIT bleeding will usually present as to us as hematemesis, that is vomiting of blood. And passage of blood through stool is usually seen in lower GIT bleeding. So when we see, somebody has joined. Okay. So when we see there is a melena, this girl is having melena, that means she's having some GIT bleeding. Okay, cool. First clue. Second clue, they are saying she has a tummy pain and this tummy pain resolves when she has eaten. What is this case? If somebody has a stomach pain, it's a very common case, even in adult medicine, and the stomach pain is relieved by eating some food. That means what kind of disease is that?
Okay.
Sorry? Dr. Priyanka, please mute yourself. It's very loud. So what kind of disease is that? If you have a stomach pain and immediately is resolves after taking food, it is usually most likely you have peptic ulcer disease, right? So this girl is having tummy pain, which usually resolves. This is very common, especially in duodenal ulcer. You will see that the pain is relieved after taking food. This is the point that is written in the books. So the pain girl will have pain in the morning, usually around 10, 12 o'clock. This is the time, and they'll usually have epigastric pain in peptic ulcer disease. And pain resolves after she has eaten. So we came to know this girl is having melena, that means some GIT bleeding. Second thing, we came to know she is having peptic ulcer disease. Now, are you guys clear how we came to know she has peptic ulcer disease?
Yes, very well, very well.
Okay.
Yes.
Now, thing is that they have not mentioned peptic ulcer disease. Now she is having peptic ulcer disease, but why is she having bleeding? What are the causes of bleeding in peptic ulcer disease? See, one important thing they mentioned here is that the girl had a fracture. See, peptic ulcer, it can lead to bleeding. When it can lead to bleeding, there has to be, due to ulcer, there has to be some perforation. Plus, peptic ulcer has to be triggered. That means the ulceration is increasing. It is eroding the muscle. It is eroding the mucous membrane. When it is eroding the mucous membrane, that will lead to bleeding. That means this peptic ulcer that she was having, it is being triggered by something. That is why we are having the bleeding. And that bleeding is causing melena. So we have the peptic ulcer disease. The peptic ulcer disease is leading to bleeding. And then that bleeding is causing melena, that is passage of black stool. Now, why she is having the bleeding in the peptic ulcer? Most of us has peptic ulcer disease. This is very common. Peptic ulcer disease is very common. Most of us will have this. Why she is having melena? We don't get melena. The thing is that there are some triggering factors of peptic ulcer disease. One is that when a patient have peptic ulcer disease, we avoid NSAIDs, right? Why do we avoid NSAIDs? Two things, because this NSAID will trigger the peptic ulcer disease. It causes irritation of the ulcer. This is one point. Second thing is that the NSAID basically it is a COX-1 and COX-2 inhibitor. Some of them are COX-1 inhibitors, some of them are COX-2 inhibitors. So if it is a COX-1 inhibitor, that means it is inhibiting COX-1. This particular COX-1 is responsible for protecting the stomach from the acidic action of the hydrochloric acid. That means when we are giving NSAID, this COX is removed. When this COX is removed, the stomach becomes more susceptible to the acidic action of the hydrochloric acid. First of all, it's already PUD. Second thing, you're giving NSAID to the patient. Why we are giving NSAID to this patient? Okay, let me show you. Why did we give NSAID to this patient? Because she had a fracture. It was mentioned that she had a fracture and she was given medicine. So in a fracture patient, what kind of medicine will you give? Definitely you'll give a painkiller. Will you give paracetamol? Paracetamol is very mild to moderate pain. You will give NSAID definitely. So NSAID, already the patient was having peptic ulcer disease. Now because of the action of NSAID, it has led to irritation of the ulcer and that is causing the bleeding. That means now let us look back into the answer, into the question. We'll not check the answers now. So we have a girl presents with a history of melena for few days. That means passage of black stool. And she had tummy pain which resolved on eating. That means she has PUD. After that, she fractured her legs 2 weeks ago, for which she has been taking medicine. That means you understood what is the cause of her melena now?
Yes, doctor.
She was already having peptic ulcer disease, yes, and because of taking NSAID, since it was fractured, she's given NSAID, and that's why she developed bleeding peptic ulcer. And due to bleeding peptic ulcer, she developed melena. Now we understood this is a case of perforating peptic ulcer or a peptic ulcer disease that is leading to melena. What is the investigation you will do in case of peptic ulcer disease? What is the commonest done in clinical practice? We'll do upper GIT endoscopy.
Upper GIT
Endoscopy. Yes. So what is the investigation? We'll do endoscopy. So this is how they correlate. It's basically, this question is not very easy, I must say. If you can, if you can snap it easily, then you're really brilliant. I took some time to understand this question when I practiced. I think when I read for the second time, then I was able to understand. So this is how they correlate. That is, you must know they are not telling you about peptic ulcer disease. They are not telling you about what medicine is given. But you have to understand from the symptoms that she had a tummy pain that in the morning that resolved when she eats. That means this type of tummy pain is seen in peptic ulcer disease. Second thing, she was getting some medicine to help with the pain. See, she had peptic ulcer disease, melena for a few weeks, and plus she was getting for the medicine for the 2 weeks. So the timing is also almost similar. Both the things are happening at the same time. So this is the case of peptic ulcer disease. So to investigate, we are going to do upper GI endoscopy. This is how you should solve questions. Now, how can you solve question in the first go? I have read the explanations. That is why I'm able to solve. If you have not read in the first go, it will be difficult for you. So what we have to do, all that I have told now is actually explained in this answer. Here, COX-1 inhibitor, COX-2 inhibitor, NSAID, non-specific, everything is explained here. So that is the reason you have to read the explanations. After that, you should judge yourself, right? After that, you can correlate. Just by solving one and reading, it's not necessary. And it's very important you read the clinical cases with a very calm mind, especially for the TAS exam. For TAS exam, a lot of people do not read the SOP book. There is a substitute, clinical cases of TAS. It's a very, very good book. Like, you should be able to understand everything. So this is how you should be solving the cases. The next case is also based on GIT. Let us go back now. We have moved a lot. Okay, so how you should study basically, if you have if you have joined my class, will follow the class, up to date with the classes, self-study, at least 3 to 4 hours of intense study every day. We'll finish this was actually prepared for my October batch examinees. So we'll finish the portions by August. September is for basically revision. And then if you think if you're ready for it, you should give the exam in October. Order of studying: first you should study the book, because not everybody is in my class. In my class I provide the PDF. If you do not have the PDF, always study the book. Or if you have the PDF, all the students of my class, I think some of you are here, you always have to at least be familiar with the book, because the pictures in the book, especially illustrated textbook of pediatrics, is very important. Next we have clinical cases of that system and recalls of that system. That's it. This is your order. Now, when do we get the result? You have given the exam, you have done everything. The results are usually published 4 to 6 weeks after the exam. That's it. This was all about Mrcpch. Okay, you have raised, yes, Dr. Faraz, tell me.
Yes, Dr. Fatima, I wanted to ask, what is the criteria to sit the exam for part 1 and part 2?
What is the
Criteria, like the requirement?
passing percentage?
No, not passing,
Criteria. Okay, criteria.
like can a fresh MBBS graduate sit the exam?
Yes, definitely. Definitely you can sit for the exam. For part 1 and part 2, you do not need any clinical experience in pediatrics. But if you have it, if you have an option, you should go for it. But it's
Okay,
not
and
compulsory.
okay, and for part 3, do we require to have, do we need to have like a diploma or any experience, or how does that work?
For part 3 exam, as I said, it's written, I think you joined a bit late. For part 3 exam, it is recommended by the Mrcpch, that is Royal College, to have at least 2.5 years of experience. So honestly, if you ask me, by the time you complete part 1 and part 2, most people, at least 1 year is needed.
Okay,
Minimum 1 year.
So do you say that we have to work in a pediatrics department, or if you work in any general field, it's okay?
No, for what, by 2.5 years, what I have heard is that they recommend to have 2.5 years. In the 2.5 years, 1 year should be in NICU. It is recommended, but a lot of people have not worked in NICU. They just gave 2.5 years experience, and that did work. You can work in pediatrics. You can do a training in pediatrics, or if you're working as a GP, or if you have your own clinic, but you should get a reference letter from somebody.
Okay, thank you very
Basically,
much.
they need a letter from your consultant saying that this person
Okay.
has worked under me or was my colleague or something for 2.5 years. This is what they need.
Okay, very nice presentation. Thank you.
Okay, anybody has any other questions? Yes, Dr. Shumaila, please tell me.
Ma'am, I want to ask if we have cleared both part 1, that is FOP and TAS, and AKP, can we work in UK? Can we get GMC registration, or we have to clear clinicals as well?
No, you cannot get a registration before completing 3 parts. You have to complete 3 parts.
Okay, we have to complete 3 parts, and it's all over and it's same in UAE as well.
No, in UAE, it's not recommended. In UAE, if you have completed, if you have given the licenseship exam, which is a DHA or MOH exam, which is regional license exam. After that, if you have, training in pediatrics, or say if you have part 1 and part 2 is completed, you can work in pediatrics as a registrar, senior registrar, or you can work as a medical officer. If you have, yeah, but
Sorry.
if you have completed Mrcpch, then definitely plus with 3 years experience, you can work as a consultant in the UAE.
But we have to complete all 3 parts for that.
Yes, for 3 parts are needed. Actually, there has been some exemption from the license exam for MRCP and PLAB candidates. That is, if you have cleared the MRCP exam, or if you have cleared the PLAB exam, you will be exempted from giving the licenseship exam. But for CH, that is Mrcpch, our exam, they have not yet done something like that. But yes, if you're going for that exam, if you have passed at least 2 exams, you will be preferred in jobs and everything. Dr.
Okay, thank you so much.
Okay, thank you. Dr. Saima, yes, tell me please. Dr. Saima, you have raised your hand. Okay. Do you want to speak? Anybody has any other queries regarding part 1? For part 2 exam, I'll be posting a video. I'll host a meeting soon. Right now, I'm really busy. This was basically about part 1, and I actually intended it to be very short. I just prepared the slide a few days ago, and it was for my this thing. I thought just the basic information. Okay, and so my Facebook, I hope you all know my Facebook page name. It is Mrcpch part 1 for beginners. For you are not audible, my dear. You are not audible. Oh, okay. Join your study groups. Study groups, you mean my WhatsApp groups? I do have WhatsApp group, and I do have Facebook group and Facebook page. Okay, are you talking about classes or just a general group? My classes are totally different. I can give you information for that separately, and you can ask for reviews online, because I know my classes. Okay, for my classes, I have like one batch running now. It's a regular batch for FOP and TAS. Usually, this is the batch I'm taking for October exam. Ask about marks calculation if we are appearing in FOP and TAS both. Okay, just let me get back to you. Okay. So for October, if it is October exam, my classes have already started. Yes, I will share the Telegram channel. My classes have already started. Usually for FOP and TAS, my classes will be for 3 months. It's a 3-month course where we complete both FOP and TAS. And after 3 months, we'll have some mock test and recall classes. And in 3 months class itself, after every system, after teaching every system, we do the recall system wise. This is my class. My classes are usually Monday and Friday, 3 hours each. Like Monday also 3 hours, Friday also 3 hours, and the recordings will be provided after class. This is about my class. This is the regular batch, which is for 3 months. And then I have another last minute batch. Last minute batch is just for revision. Basically, for every session, I do different last minute batch. Once I had in the February session, I had last minute batch, like which included the clinical cases plus recalls plus the important topics. And this June I have included the last minute batch. There was only 5 recall papers plus the important topics. I think we have some people from my last minute batch here.
Hello, Dr. Fatima.
Hi.
I want to ask. I want to ask, this Zoom meeting will be available on your channel, because I started now.
Yes, definitely. Yes, it will be available. I'll post it.
Okay, on your channel, right?
Yes, on my YouTube channel. Okay, so Dr. Zishan asked if somebody wants to join your batch only for FOP. Actually, my batch is combined for FOP and TAS. If you join my batch, you have to, I teach it together. I try to correlate and take both the topics together. For example, as I told you that, if I'm going to teach Down syndrome, I try to compile FOP as well as TAS portions together. But I do mention that FOP questions will be like this, TAS questions will be like that. But if you're joining for one exam, that's not possible. Some people, what they do is that I have some people in my batch that we join the classes for both FOP and TAS, and then they just prefer to give FOP, because eventually you have to give the exam and the classes are combined, so it's not different. And somebody asked about the marks. Okay, about the calculation. There is what sorry, I did not understand. What do you mean by calculation? Are you asking about? Okay, you're welcome, Dr. Abdul Awal. Are you asking about the passing mark? Are you asking about how much percentage is there from each system, like that? Dr. Saima. The pass percentage for TAS exam is very less, around 55. around 55, 58, something like that, in 50s. If the exam is very tough, they will decrease the passing mark. For FOP, it is around 60, 65. Sometimes, last time I remember, last year it was like something 66. One time it was 68. So FOP, you can take it as around 65. For TAS, it is around 55, something like that. Okay, Dr. Priyanka, yes, tell me. 2.5 months should be. I'm not able to see. Okay. 2.5 month duration is enough to pass FOP. 2.5 months, I think yes. Yes, it should be enough. If you are following the proper, routine and everything, definitely enough for FOP. They're saying what is your value in UK. So if you have done part 2 as well, what you will have to do is that there is, ST. If you pass part 1, part 2, you will get into the ST2 trainee level. But for that, you need the GMC registration. Now, there are two ways of getting GMC registration. One is that you can do the PLAB. Another one is that you can completely give all the parts of Mrcpch. I know a lot of people, like some of my friends, have done PLAB. And just by doing PLAB, it's sometimes tough to get into certain jobs or certain training. So they have done MRCP or Mrcpch. So by doing, if you have PLAB, if you have the registration, by doing the up to part 2, you can get training in ST3 level. But if you don't have registration, actually before completing with the registration, you cannot practice in the UK. Can you guys be verbal? Because I'm having tough time in reading. My laptop is very slow and for exam, somebody asked. Calculate marks together for both paper. Oh, no, they do not calculate. For FOP, it is completely separate. For TAS, it is completely separate. Its passing is totally separate for both. Dr. Priyanka, something you said for exam, better to go for online or particular center. If you are comfortable, if it's available in your, city, then you should go for the center. If you think it will take you, you need to travel, you're not finding seats, then you can go for the center. Now I think everybody go for, online. Everybody goes for online. Like for me personally, I like centers because it's it's very near to my place, Dubai. It's hardly 30 minutes from my place, and also it's very convenient. You don't have to worry about anything. There are so many people getting flagged, and there has been so many problems, which are like if your luck is bad. Otherwise, online is a very good option. You don't have to travel and everything. Okay. Anything else? Did I miss out on any question? Okay. Anything else you guys would like to ask? Any doubts? Oh, you're welcome, Dr. Saima. Thank you. Thank you. So no questions, no further questions. Okay. We'll hold a meeting for AKP next time, inshallah. So no questions, and I'll end the meeting now. If I ask Mrcpch is better or DHA? See, DHA is a licenseship exam, right? Dubai Health Authority. It is a licenseship exam, and Mrcpch is a postgraduate exam on pediatrics. It's totally different. If you have DHA, you are getting a licenseship to work as a GP in the UAE, in Dubai. If you have Mrcpch, you are actually a post-graduation. You are a postgraduate in pediatrics. Dr. Faraz, Dr. Shumaila, please, yes, tell me.
Yeah, Dr. Fatima, I wanted to ask, after you finish your part FOP, before how long should you write the TAS?
Before how
writing
long?
it separately. Like if I write FOP separately,
TAS.
yeah.
It's totally different. It's totally, different for different people. I took like very less time for TAS, honestly. But then for some people, I have known some people who has given separately, some people who has given for TAS again. It's like you can take about 2 months, 3 months is enough.
Okay, and now if I finish part 1, is there a time limit before I have to write part 2?
I did not get your point.
No, now Mrcpch part 1. After that, when we write part 2, the EKP, is there any time limit, like you have to finish it within 2 years? Or...
No. There's nothing like that. But it is said that there is no time limit for part 1 and part 2. You can definitely do any time. But for when you have finished part 1 and part 2 and you have not done clinical, for that the time period is 7 years. That is, after completing part 1 and 2, within 7 years, it is recommended to finish the clinical. If not, you can always give your reasons, you can email them, and they're very responsive. For part 1 and part 2, there is nothing like that, because I know a lot of people who have completed their part 1 part 2 in 2019, but then they have not sat for the clinical exam due to some reasons.
Okay, thank you very much.
Okay, somebody has asked, can we work in Oman after clearing part 1? I don't have idea about Oman, but I think their licenseship exam is needed, and license exam is very easy in all the Middle Eastern countries. You just need two years of experience after the internship, and then you just need to give the license exam. And even the exam fee is very less, as much as I'm aware of. For part 1 and part 2, like, for me, like, what I'll just give you an example, like, I have not completed clinical yet. I've just done part 2 recently. I have completed. So until doing clinical, what all thing will favor me with this part 1 and part 2, apart from the knowledge, is that if I go for a job for working in pediatrics and I have done part 1 and part 2 in Mrcpch, and there is another candidate who has not done anything and they have come just working in pediatrics, obviously they're going to prefer me. If anybody has done some work, has some training, or have some degree in pediatrics, and they will obviously, preference of job is different, like they will be preferred in jobs. But without licenseship, it's not possible. Like right now, thank you. A lot of people are going for PLAB. So PLAB is very good if you're going for GMC registration, and it's like open. It's not a single thing. It's like a lot of options you have. You can go into any branch. You can work as a GP and everything. But then PLAB is like has become so difficult because of finding the seats and everything. You have to give OAT, then PLAB 1 you give, PLAB 2 you don't know when you're going to get. So what people do mostly is that after giving PLAB 1, I personally have some students in my class who have given PLAB 1. Now they are doing Mrcpch part 1. So what is their plan is that after doing PLAB 1, then PLAB 2, they will also have Mrcpch 1 or 2 in their hand, which will help them get into better training. Can we do, if we have done FCPS, best option to do job in the Middle East? Yeah, FCPS is validated in the UAE. I think so. They'll say your experience, no number of years of experience for everything. If you have 2 years experience after internship, you can give the exam, licenseship exam in the Middle East, especially in UAE. I know about UAE, I don't know about others. Okay. Yes, for licenseship, you have to give the exam. In UAE, I'll talk about that later in some other class. This class was actually just for Mrcpch part 1. Okay. Anybody else? Anything else you would like to ask? How many of you are planning for exam in recent time, like maybe in October or February? Okay, Dr. Shumala, February. Okay, good. You have some good amount of time. You have some time. It's very good. I've seen so many people, they just come in the last moment and say they want to. I mean, who is stopping you? October. Okay, that's great. Preparing for both FOP tasks. That's great. 6 months should be more than enough. You will prepare well. Okay, any more questions? Okay. I'll try to post this PDF in my Telegram group, and I'll post the link of my Telegram group on my Facebook channel, Facebook group, as well as page. So that's it. And if you have more queries, I have taught a lot of topics on, a lot of videos are available.
One more thing.
Yes, tell me.
One more thing. Yeah, I want a study material because I today I talked to you because in Telegram I don't know in Oman maybe I'm unable to install. So can I get study material for the FOP and task separately?
Study materials. Actually, my study materials is very my study materials you're not able to find. That's what you're saying on Telegram. Okay. There's a
Yes,
lot of study
because
materials.
because in Oman I am unable to install a Telegram. Since yesterday I am trying to install, but I'm unable to install. Maybe it is not working here.
Okay, then what I'll do is I think if a lot of people, if you want, I can post in my group or I'll message you. Just knock me again. I'll send you personally. There is a lot of materials, basically all the books and all the recall papers. If you want fastest, I
because-
can. The fastest link is there in my Telegram. That's it.
Because time maybe now short for me, so maybe I will apply for only for one FOP or task.
Okay, you're going for planning for both exams.
No, I will give one because now time is short. Because before I was planning for AKP, but my registering couldn't be done.
Oh yes, I spoke to
Now
you today. I spoke to you today. Yes, go for
Yeah.
FOP. And actually in AKP portions, FOP you have to study. FOP clinical cases and FOP you need to have an idea. So what you can do is now you can give FOP. I know so many people, they gave FOP, then AKP, then task, because task is like a bit complicated. So it will help you if you go for FOP.
Because I recently cleared the FCPS. So I have a clinical knowledge, so I was planning for AKP. But AKP, unfortunately, I couldn't apply. So
But trust
now
me,
I
it's
will
going to
apply.
help you. It's like it happened for the best. You give AKP, FOP, then you in the January you can give AKP exam.
Yes.
Because a lot of portions is similar. It's overlapping. You will have to revise almost everything of FOP for AKP. It's like AKP exam is a lot. So since you'll be finishing just, if you finish October FOP, then it will be very easy for you with AKP and everything. Okay. You need materials for FOP, yes?
Yes. FOP and task separately. So I will maybe with your advice, I will apply for the FOP. But if you have a material for FOP and task separately, you could give, otherwise only for FOP.
Okay, fine. I'll try to post everything on the group because I think a lot of people joined recently. And I don't know why Telegram is not available in a lot of countries. They don't have.
Because I was trying to. It is not
because Telegram you can easily download huge amount of file, no? Very big files is easily you can download in Telegram. Okay, I'll post it on my Facebook group, on my WhatsApp group.
Thank you.
Okay.
Thank you.
Anybody else have any doubts or anything to say? Okay then, all the best everybody. I'll see you then and I'll leave the class. Thank you everyone.
Thank you.